So in today's session, our topic is microminerals, copper, fluorine, zinc, chromium, and selenium. It's chapter 14 on page number 267. Those who have the textbook, page number 267. If anyone is joining late, please help them out with the page numbers. So copper, first we'll see the copper. Copper is necessary in trace amounts for red blood cell formation, collagen formation, energy production, neuron transmission, immunity, and ion metabolism. Okay, it is a cofactor for several enzymes. These all functions which I have stated. Okay, in all these functions, copper acts as a enzyme. Okay, for example, when the skin color is formed, like your melanin. Okay, melanin is formed to for the formation of tyrosinase. Copper is required. Okay, for the formation of the enzyme called cytochrome C oxidase, which will make sure that your energy is produced by the mitochondria. Okay, for that also copper is required. Making sure that free radicals are taken care of. Okay, fighting of the free radicals through superoxide dibutase enzyme, for which copper is required. Neurotransmission monoamine oxidase is the enzyme. Okay, so the copper is a cofactor for all these enzymes. Cofactor means helper. It helps these enzymes to achieve its activities. So copper helps indirectly. It helps in all these functions. Okay, like red cell formation, RBC formation, collagen formation, energy production, neurotransmission, immunity, ion metabolism. For all these basic functions of life, copper is necessary. Copper acts as a helper trace mineral for all the enzymes to carry out these jobs. So copper metalloenzymes are the ones which I have mentioned right now. Tyrosinase, it helps in the formation of melanin. Cytochrome C oxidase, it helps in the formation of energy through mitochondria. Lysyl oxidase, it helps in linking collagen fibers and elastin fibers. It means it helps in the production of collagen, in short. Okay. Superoxide dibutase, it helps in killing the free radicals. It helps in taking care of the free radicals. Then monoamine dioxidase, it helps in the neurotransmission. So these are the metalloenzymes and their physiological functions that they do within the body. Okay, so for all these metalloenzymes, copper is a metal. Okay, so metalloenzymes, this copper metal, which helps the enzymes to carry out its function. So that's why this name of metalloenzymes takes place here. And copper exists in the form of a protein complex. Copper and a protein both combine and form a complex called as hemocurcurin. And it is in this form, it is presented in the RBCs and even in your plasma. Okay, copper cannot exist in its original metal form or in iron form. It has to form a complex with a protein. Okay, and it is called as hemocurcurin. Coming to the absorption and metabolism part of copper, dietary intake of copper, what an regular healthy adult may require, is around 2.5 to 5 mg of copper on a daily basis. And the best sources of copper are also liver from non-vegetarian food, starfish, nuts, chocolate. Okay, they are good sources of copper. So as soon as the copper enters the stomach does not play much role in the absorption. Okay, majority of the copper from the diet is absorbed by the small intestine. 25% of it is absorbed by the small intestine. Only some part of copper can be absorbed by the stomach, but majority of it can be absorbed by the small intestine. Some part of it can be absorbed by the large intestine as well. And from the intestine, it will pass on into the blood. Okay, it will get attached with the protein called as hemocurcurin, copper ion plus albumin, that is a protein. They form hemocurcurin. So in the form of hemocurcurin, copper can be stored within the liver for future use. Okay, and as soon as it is stored in the liver, and after that it is released into the bloodstream, it is called as hepatocurcurin. Okay, so this is how the absorption of copper mechanism takes place within the body. Majority of it is absorbed by the small intestine. The stomach and large intestine can also absorb copper, and in the blood it goes, and in the blood it forms a hemocurcurin, a protein complex with the blood, and once it is deposited in the liver, it forms hepatocurcurin. Copper deficiency, very rare. Okay, there are few clinical indications of copper deficiency like sparse, kinky hair, loss of developmental milestones, truncal hypotonia, failure to thrive. Thrive means to grow properly, okay, to keep up with the growth and development. That is thriving. Failure to thrive means the child is not able to keep up with the uh, growth level, what is indicated for that particular age. Epilepsy is convulsions, fits, what we call as fits. Truncal hypotonia is also an abnormality usually seen in children. It causes visual impairments as well, and completely weak muscles. Okay, no order or grip, or no there is no tightness to the muscle. Completely weak, relaxed muscles. Parts meaning very less, very less. Here you can see in the on the child's hair. Can you see the scalp properly? The scalp is very much visible. So this is a meaning of sparse. Yeah, drinking water in copper vessels. If you drink usually more than 1 liters of water on a daily basis from copper vessels, it could lead to copper toxicity. High chance. Neutropenia means your WBC, neutrophils, your WBC, are very low in count. Not just drinking the water from the copper vessels is a treatment here. Usually, children who have this copper deficiency called as Menkes disease, they are treated with copper supplements specifically. Okay, because copper supplements are formulated in such a way, copper sulfate. Okay, like that. The formulation is in such a way that the child's intestine is able to readily absorb copper supplements. It's also seen, this deficiency is also seen in people who have undergone burns, they have celiac disease, gastric surgeries done, okay, or long-term intestinal issues are going on, colon cancers, for example, okay. And for a very long time, the patient was on parenteral nutrition, means the patient may be on coma, okay, was completely unconscious. Blood test has to be done, blood plasma test is done to understand. So usually when a patient, a ready person is in comatose situation for more than a month or so, they can also develop copper deficiency because all their nutrition comes through injections, okay, IV fluid. Zinc supplement and copper supplement, they both fight each other for absorption. Zinc wants to take up all the absorption routes, and copper also wants to fight zinc to take up all the absorption routes. So they have a very conflicting kind of absorption. Yeah, similarly like for iron and calcium. Keeping it whole night, obviously the concentration of copper ion increases, but even if you keep it for few hours, okay, that is fine. And cooking in copper vessels also, if you regularly cook in copper vessels on a daily basis, right, it could lead to toxicity. Copper poisoning occurs from the contamination of food with copper from containers or any ingestion of high qualities of copper salt. Okay, and copper poisoning could also happen because of always drinking water from the copper vessels only, not having any other source of water, or always eating food in copper utensils, copper cooking utensils, copper eating utensils. Everything is like related to copper. Or the water that you use, okay, the water that potable water that comes to you, okay, that is poison, that has high levels of copper ions. Okay, so that could also lead to copper poisoning. It if untreated, it is dangerous because it leads to Wilson's disease. Menkes disease is the deficiency of copper. Wilson's disease is the toxicity of copper. Okay, in one of the classes, I guess, metabolic errors, inborn metabolic errors. Okay, correct me if I'm not wrong. In inborn metabolic errors, we have discussed in detail about Wilson's disease. So these are the tests that you do for and understanding what is the copper concentration in your plasma, low serum copper levels or low serum ceruloplasmin levels. Okay, like ceruloplasmin is also a protein, copper protein complex in which copper is found being circulated in your blood. Okay, treatment, copper chloride or L-histidine injections are given. Don't just depend on copper vessels for treatment because copper has to be present in a specific combination with another mineral so that it enhances the absorption. Okay. Copper toxicity. This is copper poisoning. Too much of copper in your diet. Um, systemic level means whole body. Whenever we say systemic level, whole body, what kind of presentation you will see in terms of signs and symptoms. The patient will have chills, that is shivering, fever, pain, eyes will be yellowed, okay, because of jaundice. Why jaundice? How is jaundice happening in copper toxicity? Any guesses? If you remember the absorption slide, any guesses why how liver is involved? Copper is stored in liver in times of toxicity. Too much copper gets stored in liver. It causes inflammation. Okay, excess of copper will start the toxicity in the liver itself. It will cause damage to the liver cells, liver tissues. Any damage to the liver cells, liver tissues will lead to jaundice. Is it clear now? Hepatocorporin is the form in which copper is stored in liver. Okay, so that's how you get jaundice here. Mouth will have a metallic taste, very similar to, I guess, you those who drink copper water on a daily basis. So like overnight you keep copper in a vessel, in a tumbler, and the morning you drink that water. Definitely you must feel that metallic taste in your mouth. Is it evident to you? Like those who practice this, it is like something that majority of people practice. Early morning, when you have copper water which was kept overnight in a copper tumbler, do you experience that metallic taste in the mouth, which is very different from consuming regular water? Okay, the same kind of taste is persistent in the mouth of people who suffer from Wilson's disease, a metallic taste. Okay, so anemia, shock. Why anemia? RBCs are formed, but again, the RBCs which are formed because of copper toxicity are immature ones, not functional ones. Okay, the body may go into a stage of shock. At muscular level, convulsions, fits can take place. Okay, because remember, copper was associated with neurotransmission. Copper is associated with neurotransmission. Okay, so convulsions can take place, ashes can take place, weakness. Okay, gastric level, vomiting, nausea, abdominal pain, burning sensation. All the GI symptoms can take place here. Kidneys, lack of urine production. Intestine, diarrhea. It could be bloody diarrhea or bluish diarrhea. Okay. Liver, decreased function because hepatocytes are under functioning. Okay, so these are the some of these signs and symptoms are common in uh, uh, other disease conditions as well. Okay, muscle pain. It's not ashes, it is aches. They have given a wrong spelling here. Copper toxicity continuation. This is Wilson's disease. Too much of copper is Wilson's disease. Too less of copper deficiency is Menkes disease. Okay. So sometimes what happens is that because of some genetic defect, okay, this is inborn errors of metabolism. Okay, copper from the diet is is in the same form. Okay, but because of the genetic defect, majority of the copper is taken up by the body, is absorbed by the body. Okay, and what happens is here that either the majority of the copper will go, ends up get deposited into the liver, and the other majority, so other some part of it may go and get passed out from the body through urine. Okay, so if there is any more copper left after getting rid of the 90% and 10% of it at some point, if it is more copper ions are left, that will go and get stored in the soft tissues. So in Wilson's disease, you will see the pupil of the eyes, okay, of those who are suffering from Wilson's disease, the pupil of the eyes will have this copper tint to it because of the copper ions getting deposited in the pupil of their eyes. Okay, so Vincent's disease is the metabolic condition, inborn errors of metabolism, in which, because of a genetic disease, uh, copper is not completely excreted from the body. It is taken up wholly and absorbed completely from the body. So RDA of copper, again, when it comes to the RDA, no need to memorize it. It's hardly 2 mg per day according to ICMR, Indian adults also, and those who have wheat-based diet, they are supposed to have a little more of copper because in wheat-based diets, certain phytates and oxalates can hamper the absorption of copper. Please take a quick snapshot, those who require this slide. Coming to the best sources of best sources of copper: oysters, shellfish, liver, your seafood, liver, animal foods. Okay, when it comes to vegetarian sources, mushrooms, quinoa, almonds, cashew, lentils, chia seeds, sesame seeds, raisin, avocados. Okay, sunflower seeds as well. Okay, soya bean also has a good source of copper. Chocolate as well, the rich source of copper. Naturally, vegetables and fruits have a very low content for copper. Majority of the copper is found through seeds and other grains, pulses. And if you are using refined flour like maida, okay, when you're using refined flour of any grains, it will remove the copper from it. The more refined items you used, more will be the reduced copper quantity in that. So about copper, is it clear to all? Coming to fluorine, next mineral is fluorine. It occurs naturally as a negatively charged ion called as fluoride, okay, represented by F minus, it is negatively charged. About 95% of the total body fluoride is found both in your bones and teeth for mineralization. Fluorine will mineralize your bones and teeth. Okay, major functions of fluorine: it hardens your teeth enamel. Okay, makes your teeth stronger for your dental health, protects your teeth from dental caries. Okay, and it stabilizes the structure of the bones so that a good skeletal growth is achieved. And also, when it comes to bone health, it's not about just mineralization. The way how the bones grow during childhood, okay, the way how the bones shape is intact, and the way how it grows, the way how it moves upwards, downwards, bends, okay, that is governed by fluorine. We will see that in the deficiency, what happens in the fluorine deficiency. So fluorine absorption, it is rapidly absorbed by passive diffusion immediately through mouth, stomach, small intestine, okay, lungs as well, skin also. So 86 to 97% of your fluoride can be absorbed through your intestines, and absorption from drinking water is the most common way and complete way to get your proper fluorine intake. So excess of fluorine will be excreted from your feces, sweat, saliva, if it is a lactating mother, through breast milk. And the main route of getting rid of excess fluorine is through your urination. And when the when the fluorine is stored within the body to a certain extent of time, it can be stored in the soft tissues as well as in the calcified tissues. That is the skeletal system. RT hardly 1.5 mg per liter of water is what we target. Or if you are able to maintain at least 0.8 to 1.2 mg of fluorine per liter of drinking water, it can have its various benefits, and it can also minimize the harmful effects for the future generation. So usually municipalities and all, they usually check the fluorine levels in their uh, water. Okay, even at home, you can consult with your local regional laboratory and do this check. What kind of fluorine levels do you have through your tap water, filtered water? Okay, so sources of fluorine on this toothpaste, whatever toothpaste you use, whichever brand, all brands of toothpaste is enhanced with fluorine. They have fluorine in them. Fluorinated water supplies like the Aquafina, distillery waters, water that you buy from outside. Okay, they are extremely fluorinated as well. Mouthwashes also, whatever you use for your oral hygiene, can easily be enhanced with. It can be fortified or enhanced with fluorine presentation. Food processed with fluorinated water, fluorine supplements when it is too when the deficiency is major, fluorine supplements may help out. So fluorosis, this is an old data. Okay, it's a data from 1999. previous century. So fluorosis is a disease condition in which your teeth is affected. Sometimes if it is untreated, your bones will also get affected. So these are the states which you see in red mark. Okay, these are the states where fluorosis is highly prevalent. Okay, fluorosis means too much of fluorine in the water, and that leads to fluorosis. So, does anyone remember about the Nalgonda district case of Andhra Pradesh? Earlier it was Andhra Pradesh. Now we have Telangana, Andhra Pradesh. Now Nalgonda is in Telangana. Is anyone aware of you must have studied those who are from the medical background, Nalgonda case of fluorosis. If you have done your community medicine or you had a community medicine, community health chapter, Andhra Pradesh and Telangana are still affected by fluorosis, even in certain regions, Gujarat, Rajasthan being the other states. Fluorosis means lot of fluorine is present in this part of the region in their soil itself. So what happens is that the groundwater itself has high levels of fluorine, which could turn toxic to the consumers. Okay, those who are consuming groundwater, it will turn toxic to the consumers. Okay. So valgum and varum. Okay. Genuvalgum, genuvarum, knock knee and bowlet. So this happens because of the fluorosis. Okay, too much of fluorine in the water. Uh, when it is knock knee, it is called valgum. Those who have done physiotherapy, they would know there are certain physiotherapy exercises also. If it is not too serious in this situation, surgery may be required for this child. Okay, and varum is bow-legged. The knees will not touch, ankles will touch. In knock knees, knees will touch, ankles will not touch. Okay, that is genuvalgum and genuvarum. Another sign and symptom is about the discoloration that you find on teeth. Okay. In mild cases of fluorosis, you can see here small white patches are seen over the teeth. Okay. Very mild. In mild cases, the teeth will lose its luster and gloss. Okay. It becomes almost mattified and chalky in nature. Slowly you can see from very mild, moderate to severe, how the color changes. Okay, color changes takes place for the teeth. Okay, if the teeth that visually loses its gloss, its appeal, its color, it becomes more mattified and chalky in nature. Okay, this is because excess of fluoride ions are getting deposited because of fluorosis. Too much of fluorine in the body, excessive fluorine ions are getting deposited on the skeletal or calcified tissues, teeth being one of them. So effects of fluoride toxicity, acute effects, short-term effects, which can be treated with certain supplementation and medical management, nausea, vomiting, hypocalcemia, too less amount of calcium in the blood, tetany, specifically for your hand and feet, hypotension, low blood pressure, hypersalivation, too much of saliva being secreted, metabolic and respiratory acidosis, the body becomes more acidic in nature due to failure of renal and respiratory system, coma, convulsions leading to death. Okay, death being the severe most situation in acute fluorosis. Chronic fluorosis, slowly over a period of time, since you're born, you're drinking the same water from the same source, okay, which is highly fluorinated. So you will suffer from chronic effects of fluorosis. So dental fluorosis may take place, which I have shown you in the previous slide, how this is the case of a dental fluorosis. Then skeletal fluorosis can take place, genuvalgum, genuvarum, hypersensitivity reactions, too much of allergies, dyspepsia, indigestion. Dyspepsia means indigestion, gastric irritation, insufficiency of renal system, numbness, specifically the at the fingertips or end of the fingers, you will start feeling numbness, muscular spasm. Even without you doing anything, your muscle will go into a stage of spasm in which it is contracted. It does not relax and it is painful. Okay, any part of your body, you must have noticed that at certain uh, point of time, involuntarily, you do not have any control over it. The muscle will undergo spasm, that is contraction. It is painful contraction, and you will take time to recover from it. Dyspepsia means indigestion. Stomach is not able to digest properly. So this is the Nalgonda technique. Okay. So this was earlier the district in Andhra Pradesh, but now it is in Telangana. So majority of the children born in this particular district, they had a lot of cases of bow-legged leggedness. Okay, genualum, valgum, and fluorosis, dental fluorosis was common, pretty common in this particular district of the state. Okay, so after doing research from even the researchers from international origins also, they came and they did research in the Nalkota district of Andhra Pradesh, and they found out that the groundwater which was present in the Nalkota district, it had high levels of fluorine content in it, because of which the entire generation was suffering from fluorosis. Even the past generation, current present generation, they were suffering from fluorosis, dental as well as skeletal fluorosis. Okay, so one second. So the residents, along with the team that came out to find a solution for this, okay, they had this Narcota technique installed in all the households. Okay, even the local population was taught how to do this technique at home, so that they have a treated water which is less in fluorine content, which is not toxic in fluorine. Okay, so here to make the water free from fluorine to a certain degree. Okay, free from fluorine, you have to add alum, okay, and lime into the water. This the amount used of alum and lime, it is predetermined. Okay, for 1 liter of water, this much alum or lime is required. They teach them. Okay, how health education is given to them. And lime means it is chuna. Okay, you call it as chuna in Hindi. uh, Alum, you can use your own mother tongue, in whatever mother tongue what you call alum. Please put it in the chat box. In Hindi, it is called fit curry. In other languages, I am not sure about. Fit curry is what we call it as in Hindi, alum. Lime is the chuna that you use, usually with betel leaves. Very common to use lime with betel leaves. Okay. So predetermined quantities of alum and lime is added into the water, mixed well, okay, and wait for the precipitate to form. Okay, flocks means precipitate. You can see here raw water they have took from directly from the source. They had added lime and alum in that, and you can see the precipitate that has settled down. Okay, it is insoluble. Precipitate means it will not get dissolved. It is insoluble. So once it settles down, automatically you can use a filter sieve, okay, and filter out all the precipitate, and the fresh water can be collected in the container. Okay, and this you can drink. Now you have treated water which is healthy and safe for human consumption. Okay. So this the sludge, the toxic sludge which was collected here at the end, you can see here, it has to be disposed of properly. Okay, the remaining water you can filter and drink. So this technique, Nalgonda technique, was developed in India. It was also implemented in some states, some other countries like Tanzania and South Africa. Okay, again, this part of the world also had high fluorosis incidences. Okay, so from even wherever the fluorosis incidence is seen, this technique, which was developed in India, has been implemented in all these places. Household and it can be a household or community level technology, which means the districts which has high fluorine content in their groundwater, if they have a municipality water supply services, it is a job of the municipality or whoever is the water supplier. It's their job to make sure that at the industrial level they filter out the water using this technique, using the lime and alum technique. They filter out the water at an industrial level, and the fresh water, drinkable potable water, is supplied to the residents. Okay. But if it is a household technology, means what? Where municipalities are not present. Okay, small towns, small villages, remote areas. Okay, where you can't expect municipalities to come and give you fresh drinkable water. This setup can be made at a household level. Every household can have this setup made, these articles delivered, and they can filter and use their own water. Okay. I'm not sure what is the amount used exactly, like what amount of uh, lime and what amount of alum is used in 1 liter of water. If you search about that or you just read about Nalcota technique, you will get an idea of it, because I'm not exactly sure how much lime and alum you have to use for this technique to work for 1 liter of water or so. Okay. We also have a national program for the prevention and control of fluorosis. Okay. So this program was developed in the year 2008 to 2009, and still it is undergoing. But now it is under the National Rural Health Mission. Okay, under the Niti Aayog. Niti Aayog, once it came, National Rural Health Mission was a part of Niti Aayog. So now Niti Aayog has took over the national program for prevention and control of fluorosis. So the main function that they have is to check how many cases of fluorosis we are getting at a national level on a yearly basis, and from which states we still get high levels of fluorosis cases. Community training, community health education, manpower, instilling health education in ASHA workers, community health workers, okay, multi-purpose health workers, making sure that they know to give health information, establishing diagnostic facilities where the blood samples can be checked, or the groundwater fluorine levels can be checked. So about fluorine toxicity, is it clear to all? What is skeletal fluorosis? What is dental fluorosis? Next is zinc. So zinc, the main functions, usually an adult, a healthy adult will have around 1.5 to 2.5 gram of zinc present in your body at any given time. Okay, in it is also present in cells, tissues, organs, your fluids, secretions. Okay? And majority of the zinc is present in your muscle and bone. And the other part of it, around 10% of it, is found in soft tissues. organs, and some fluids or enzymes that your body produces. Blood will contain only the least amount of zinc, that is 0.1% of body's zinc. The functions of zinc, it supports our healthy growth and development. It supports the reproduction as well, the production of the sperm and ova. It requires zinc. Supports your immune system, helps the WBCs to tackle the infection, helps your nervous system. Zinc also supports the formation of leukocytes, the health of your uh, immune system. Okay, helps our nerves carrying messages between the brain and body, that is neurotransmission. Helps your body to build protein from the essential amino acids and non-essential amino acids that you have ingested through food. Okay, to break it down and to make new proteins, zinc is required. It also helps your DNA from getting mutation. Okay, and it regulates your gene expression to make sure that genetic disorders are not, even if it is transmitted through genes, it is not shown up. Okay, it also prevents mutation to a certain degree. These are the functions of zinc in a snapshot, and they are also like some enzymes produced within the body. They also require zinc as a cofactor. It also has antioxidant properties, which is not mentioned here. Zinc also has antioxidant properties. Absorption of zinc directly through active transportation. Okay, zinc will enter into your enterocyte. Okay, and from the enterocyte, using a specific channel, zinc TN channel, it will enter the blood circulation. Okay, and from the blood circulation, wherever zinc is required to be stored in the liver for bone health. Okay, for uh, the production of semen, for ejaculation. Okay, proper ejaculation. Also, the proper amount of ejaculation. Also, zinc is required in males. If excess zinc is present, it will go through fecal loss as well as urinary loss. Sweat loss also, if you're sweating a lot, if you're dehydrated, zinc is lost from the body. For the heart contractions, okay, remember zinc, majority of zinc is present in the muscles. Heart is also a muscular organ, so a lot of zinc is present in the heart muscles as well. Then even in pancreas, zinc is present. So the absorbed zinc will go into, zinc has a specific channel for absorption and special channel to go get out of the intestine. How is zinc related to your immunity? Zinc is a gatekeeper for your immune function. Okay, in case of zinc deficiency, there will be too much of inflammatory cytokines produced and reactive mediator produces. What happens here is that you will have a lot of allergies. Zinc deficient people, their body reacts quickly to any form of allergy. Okay, thymus atrophy, which means the thymus gland, which is supposed to produce your T lymphocytes. Okay, thymus gland supposed to produce the T lymphocytes, that will reduce in its size and the number of cells. So it will produce only very less amount of T lymphocytes. So thymus gland will atrophy. Atrophy means reduction in the size and shape. And then disbalance of the lymphocytes, Th1, the helper T cells. Okay, helper T cells 1, helper T lymphocytes 2 will be disbalanced. Less B lymphocytes and more T helper T17 leukocytes. These will not help in improving your immunity. Zinc homeostasis means balanced amount of zinc when it is present in your body. You are not deficient, you are not toxic. Okay, balanced amount of zinc when produced in the body, or when it is present in the body, you have a balanced immunity and its function. Your immunity is not overreactive or underreactive. Overreactive immunity will take place in deficiency. Quickly, your immunity will react to anything. You will have a lot of allergies in short. Balance between tolerance and defense mechanisms is also seen when the zinc number is correct. Zinc level is correct. Then excessive zinc, too much of zinc, it will suppress your T lymphocytes and B lymphocytes function. Okay, overload of T lymphocytes which are not matured. Okay, direct activation of macrophages. So it will suppress your immunity to a certain degree. Your immunity will not be hyperactive or hypervigilant, but it will undergo suppression. Okay, so this is how zinc becomes a gatekeeper for your immunity. Symptoms of zinc deficiency: certain spots on your fingernails, white spots, low energy, insomnia, infertility, specifically in males, loss of taste and smell, skin rashes, eczema. Eczema means that redness and rashes, inflammatory skin rashes, loss of appetite, lowered immunity, poor memory, sinus problems and allergies. In deficiency, I have mentioned your body goes into a stage of hypervigilance. Okay, zinc deficiency, body goes into a stage of immunity, goes into the stage of hypervigilance. Even the items or substances which are not harmful for you, but the body will consider it as harmful and make you allergic towards it. Okay, so that's how zinc deficiency leads to allergy. Breast and prostate cancer, loss of libido, lack of interest in sex, frequent colds and flus because of immunity is weaker, abnormal hair growth, slow thinking process. So these all are the symptoms of zinc deficiency. Zinc, other functions of zinc, it is essential to convert beta carotene into active form of vitamin A. Zinc in human beings, it plays an important role of cell-mediated immunity, and it is also an antioxidant and anti-inflammatory agent. In the previous Wednesday session class, we have took about immunity in detail regarding different forms of immunity. Please go through the Wednesday class playlist. You will find the answer. You will find the chapter on immunity. So zinc also has an antioxidant effect as well as an anti-inflammatory effect. Coming to the toxicity of zinc, again, nausea, vomiting, diarrhea, stomach pain, epigastric pain means stomach pain, abdominal cramps. These all things are very common in other toxicities as well. Altered blood lipids, too much of LDL, low density lipids, and too less of high density lipids. Copper deficiency can take place in zinc toxicity because, as we have seen, copper and zinc fight for the absorption. Okay, so one is getting absorbed too much, the other one automatically the absorption falls down. Then anemia, because copper deficiency is there, copper is not there for RBC formation, anemia will take place. Altered immune response, which means less amount of lymphocyte stimulation, chemotaxis, and phagocytosis, which is very important when it comes to you being attacked by a new virus or a new bacteria or anything that is microbiome. Okay, so in an attack given to you by a microbiome, lymphocyte stimulation, chemotaxis, phagocytosis is important. Okay, but the other way of immunity is how you react to allergy. This is about the zinc toxicity. RDA, on table 14.1 you can find the RDA of zinc. Man, woman, pregnant woman, lactating woman. Okay, no need to buy heart, just for your understanding. Whenever you require the fact, it is available. So best sources of zinc: animal products. All seafood and animal products are good sources of zinc. In plant products, mushrooms, okay, legumes, whole grains are good sources of zinc. Any multivitamin tablet you take, zinc is an important factor in that as well. Fruits and vegetables are moderate source of zinc, not a healthy or best source. Nuts, any form of nut, okay, cashew nut, peanut, any forms of nuts, walnuts, okay, pistachio nuts, they are good source of zinc. About zinc, is it clear to all? Toxicity, deficiency, functions, best sources. Next is chromium. So chromium content in an adult body is around 6 mg, and it is present in all of your organic matters wherever, like, no, it's not just like soft tissues, calcified tissues, no, everywhere. Okay, everywhere in your body, wherever organic, your body is made up of organic matter. Okay, so then everywhere in your body chromium is found, so it is an essential nutrient. So functions of chromium, it is involved in metabolism, specifically the metabolism related to insulin, the action of insulin, okay, and how it affects carbohydrate, lipid, and protein metabolism. Okay, so chromium is involved in that. It improves your insulin's efficiency and energy efficiency, the way how insulin reacts to high blood glucose level, okay, and how well and how much amount of energy your body is going to produce after metabolism. Okay, for that also chromium is important to improve diabetes and sports performance. Diabetes, why? Because insulin's efficiency is better with chromium supplements. So even if you're taking artificial insulin, diabetic patients, if you are taking artificial insulins, chromium supplements can give that extra push to your artificial insulin. Whole grains, legumes, apple, brewer's yeast, these all are great sources of zinc. The relation between insulin and chromium is not clearly verified yet, but it has been shown that it has a beneficial effect on the serum uh, triglyceride levels, which is very common among diabetics. So, deficiency of chromium, it could lead to some metabolic syndromes, metabolic inefficiencies, okay, and glucose intolerance, insulin resistance, high levels of blood glucose levels, okay, too much of glucose in urine, because everything related to diabetes can, you will see popping up in the deficiency part. Malnourished children, diabetic people, elderly people, okay, chromium deficiency is very commonly seen in all these cases. 50 micrograms per day is the recommended RTA, and the best sources of chromium, as we have mentioned, apple, legumes, brewer's yeast, oysters, liver, potatoes, chicken, and whole grains are moderate level good sources, not best sources. Next, coming to selenium. So it occurs naturally in food almost exclusively in form of organic compound. Like, it is not found in selenium form, but it is found along with any other organic compound, like selenocysteine. Cysteine is a protein. Selenocysteine, so it's a protein compound. So the main functions of selenium within the body, it will immediately boost your immune system, helps prevent Guillain-Barré disease. That's a disease condition. You don't have to know about that in detail. You just know the name, Guillain-Barré disease condition, usually seen in children. Their bones are affected. It helps prevent cancer and heart disease to an extent. It prevents, okay, to an extent, doesn't cure. Protects against fungal and microbial infections, helps to regulate the production of thyroid hormone, so hormonal balance, aids in reducing hair loss and preventing dandruff. It gives relief from rheumatoid arthritis, gout, and eczema. It also has a like, how does it help in thyroid hormone? It makes sure that the metabolism of thyroid hormones are taken place correctly, the way how it is disposed correctly. So that are the important functions of selenium. It also acts as an antioxidant, very similar to vitamin E. RDA is around 40 microgram per day, very less, but you get that amount of selenium from any diet. Best sources are meat, seafood, cereals, and millets. Bioavailability is less in cereals and millets, but it is still present. Some other trace minerals they have mentioned the textbook on page 283. Just you can read